All right, hello everyone and welcome and thank you for joining us today. For those of you who are new to our webinar series, this is a project of the Center on Budget and Policy Priorities, which is a nonprofit policy think tank in Washington, D.C. This series is designed to help advocates, assisters, state and local officials, and others assist people accessing and understanding the Affordable Care Act's health coverage options. It's intended for those working on the implementation of health reform and is not intended for press purposes. Today's webinar will discuss the 2017 changes to the special enrollment periods and will provide a detailed explanation of new pre-enrollment verification processes for SEPs. So to guide us through today's presentation, we will have Shelby Gonzalez, a Senior Policy Analyst here at the Center, and Hallie Cloud, our Health Outreach Manager here at the Center. And then after that, we'll move on to Q&A. So to start, I will turn it over to Hallie to begin.
Thank you. So first we're going to review just some really general information about special enrollment periods. SEPs, as we call them, are triggered by certain events like losing other coverage, and they allow a person to either enroll in or switch plans in the marketplace. Generally, an SEP is available for 60 days after a qualifying event, but some SEPs are available 60 days before the event as well. Now, as you all are aware, some changes and limitations were made to SEPs in a recent rule that was finalized by HHS in April, and those changes went into effect on June 19th of this year. Yesterday, we had a webinar and talked about a lot of those changes, and today we're going to focus on the changes to special enrollment periods. One change that does impact SEPs is the shorter open enrollment period for 2018 coverage. Open enrollment this year is only going to run from November 1st through December 15th, 2017. So that's a total of 45 days. This is half the time open enrollment was supposed to run, and it's really, really going to crunch things for you guys. We're going to go into this, but SEPs are going to be a lot harder for people to access, and many SEPs will require some sort of prior coverage in order to be eligible for the SEP. So getting people insured during open enrollment is going to be incredibly important. Also, it's important to point out that states with state-based marketplaces that do not rely on healthcare.gov can implement a longer open enrollment period. At this point, we know that California is doing this, but I think that's the only state that we know is doing this at this time. And you should check with your state marketplace to see what they're planning to do for the upcoming open enrollment. So now let's review the broad categories of events that can trigger an SEP. We're not going to spend a lot of time going into all these different events, but we do have a detailed explanation of all the triggers and timing of every SEP in our newly updated SEP reference chart, and there's a link at the bottom of this slide, so you can review all of that information. Today we're going to focus on the changes. The eligibility rules around qualifying events that trigger an SEP haven't changed too much, but the main thing to point out is that a lot of these SEPs do require some sort of prior coverage in order to be eligible for the SEP. Some of these existed before the new HHS rule, like someone who has a change in eligibility for cost sharing reductions. You would need to be currently enrolled in a qualified health plan in order to get this SEP. But a big change that happened is that for the SEP for marriage, one spouse must have been enrolled in minimum essential coverage for at least one day in the 60 days before the marriage. So that's a huge mouthful. So we're going to go into more detail on that. So as I mentioned, people will only be eligible for an SEP when they get married if at least one spouse has had at least one day of minimum essential coverage in the 60 days prior to the marriage. This mirrors the prior coverage requirement that is currently in place for people who make a permanent move. So how does this work in practice? Let's look at Jay and Kim. They got married on July 12th. Kim was insured through her job until she decided to drop her employer plan because it was just too expensive. Because she voluntarily dropped her coverage, she was not eligible for an SEP due to a loss of other coverage. However, because she and Jay recently got married, they may be eligible for an SEP. Both Jay and Kim were uninsured at the time of the marriage, but do they fulfill the prior coverage requirement for this SEP triggered by marriage. Let's say that Kim dropped her employer plan at the end of May. She had coverage at least one day in the 60 days prior to her marriage, so both she and Jay are eligible for this SEP. But let's say she dropped her plan earlier in the year, so at the end of April. She did not have any coverage during the 60 days before her marriage, and Jay is uninsured during this entire time, so the marriage does not trigger an SEP in this case. So that's a really big eligibility change, but now let's go into a change on how people already enrolled in a marketplace plan can use an SEP, and this is a huge change, a huge process change. Anyone who is currently enrolled in a marketplace plan, if they're eligible for an SEP, they can only use the SEP to change plans within the same meta level as their current plan. If in rare cases where there are no plans available in that same meta level, the person can enroll in either one meta level higher or one meta level lower than their current plan. Again, this is probably going to be rare, but it's really important to point out nonetheless. So what does this mean? Basically, if someone is enrolled in a bronze plan, so they enroll at open enrollment, and then later in the year a life event occurs and they're eligible for an SEP, they would only be able to use that SEP to switch to another bronze plan. Except if someone is eligible for an SEP due to having a change in eligibility for cost sharing reductions, they can use that SEP to change to a silver plan if they are not already enrolled in one. So as kind of a reminder, this cost sharing reduction SEP occurs when you have a change in income or household size that affects your eligibility for cost sharing reductions. So it would apply if someone crosses into a different level of cost sharing reduction. So say they were at 220% of the federal poverty line, and then they drop to under 200% of the federal poverty line, they would be eligible for a more generous level of cost sharing reductions. So they would get this SEP. So let's look at an example of how this would work. So Gloria is self-employed and enrolled in a bronze plan with her family during open enrollment. In June, she loses a client and her income drops from over 400% of the poverty line to 300% of the poverty line, making her newly eligible for premium tax credits and eligible for an SEP. Now, because she is already enrolled in a marketplace plan, her plan selection options are limited. She can enroll in another bronze plan, but she cannot enroll in a different meta level. This means that if she wanted to enroll in a silver or gold plan with more generous coverage, she wouldn't be allowed to do so at this time. However, let's say that Gloria's income drops to 233% of the poverty line. She is now eligible for cost sharing reductions. Her plan selection options are still limited, but she is allowed to switch to a silver plan even though she is not currently enrolled in that meta level. This is because she is eligible for those cost sharing reductions, and those are only available to people enrolled in a silver plan. So you are allowed to enroll in a silver plan if you aren't already enrolled. In addition, there is one other restriction on plan selection for current enrollees who are eligible for an SEP because they gained a dependent. So if someone gets married or adds a dependent due to birth, adoption, placement for foster care, or through a court order, there are pretty limited options for plan selection. Basically, an enrollee can add their new dependent or new spouse to their existing plan, or they can enroll the new dependent or the new spouse in a separate plan as long as the new dependent or spouse is not already enrolled in marketplace coverage. And in rare cases where an enrollee's plan doesn't cover dependents, the enrollee and the new dependent or the new spouse can enroll in a new plan together with the same meta level as the enrollee's current plan. So how would this work in practice? Let's go back to our example with Jay and Kim. They got married on July 12th and they are eligible for an SEP. Kim was insured through her job until the end of May, and Jay was uninsured. Neither are currently enrolled in marketplace coverage, and they would like to enroll in a plan. So what are their options? They're newly enrolling in marketplace coverage, so their plan selection options are open. They can enroll in a plan together at any meta level, or they can enroll in separate plans at any metal level. But now let's say that Jay wasn't uninsured. Let's say he's enrolled in marketplace coverage when the marriage occurred. Since Jay is currently enrolled in coverage, his plan options are limited. He can have Kim enroll in his current plan, or Kim can enroll in a separate plan at any metal level. But Jay cannot change plans unless his current plan doesn't cover dependents. In that case, Jay and Kim could enroll in a plan together that is at the same metal level as Jay's current plan. Now, there are a few SEPs that are exempt from these restrictions on plan selection for current enrollees, and those are listed here. There's the SEP for American Indians or Alaska Natives, also known as AIAN. There's the SEP for errors, misrepresentation from the exchange or from an exchange entity. There's exceptional circumstances, which are things like a natural disaster or a medical condition that kept a person from enrolling during open enrollment. And then there's the SEP for victims of domestic abuse or spousal abandonment. So those do not have any restrictions on plan selection for people who are already enrolled in coverage. So with that, I'm going to turn it over to Shelby, who's going to go over this SEP pre-enrollment verification process that just started.
Great, thanks, Hallie. And hello, everyone. I'm going to focus on the new pre-verification process for certain special enrollment periods. I want to start off by clarifying that everything I'm going to talk about is related to the process that healthcare.gov began implementing in June for certain people who are eligible for special enrollment periods. 3 items that I want to kind of cover before we get started include, the first is that this pre-enrollment process is different from the process that was previously in place, which required some people to submit documents to prove their eligibility for an SEP after they enrolled in a plan. Next, states are not required to implement these processes, state-based marketplaces that is, and we don't know of any of them that are implementing these processes at this time. And then third is that this process that started on June 23rd, some parts of the process are still a little unclear to us, and we're only sharing what we know about the process so far, but we're really eager to learn more about how it's working, and we'd like to hear from you about it as you have some more experience with the process. So the new process is referred to as an SEP verification issue, or SVI for short, and I'm going to refer to it as SVI during the presentation. I know there's a lot of acronyms and it can get confusing, so I just really want to lay that out. SVI is what we refer to when there's an SEP verification issue. In other words, somebody has attested to having an SEP and is required to provide verification as proof of that being eligible for that SEP. So it requires people newly enrolling in the marketplace, it's only for those newly enrolling in the marketplace, using certain special enrollment periods to provide documents that prove that they're eligible for the SEP before enrolling and using marketplace coverage. People who are already enrolled in marketplace coverage and become eligible for an SEP are not required to provide proof, as I mentioned before. So people who must turn in documents because they're subject to SVI will be told so in their marketplace eligibility determination notice, and they'll have 30 days to provide documentation after the date they select the plan. Once SEP eligibility is verified, the enrollment file is sent from the marketplace to the insurer, and the applicant will pay the premium in order to effectuate coverage. Like I mentioned, we're only describing what healthcare.gov is implementing, and states that don't use healthcare.gov are not required to use this process. So from what we understand, SVI will eventually be required for all people newly enrolling in marketplace coverage using SEPs, but this is not happening all at once. We currently know of only 2 phases. The first phase started on June 23rd for people who attest to being eligible for an SEP due to loss of coverage or a permanent move. For phase 2, which will start in August, people who attest to being eligible for an SEP due to getting married or being denied or losing Medicaid or CHIP coverage or gaining a dependent through either adoption or foster care or child support orders will then become subject to SVI. Important to note that in August, SVI won't be required for the birth of a baby that triggers an SEP. So at a glance, when we think about who has started being affected under phase 1, I'm going to first kind of talk about the people who become eligible for an SEP due to a loss of minimal essential coverage. This is the reason that most people qualify for SEPs, so it's important to think about that a large share of people who become eligible for an SEP are going to try to enroll with an SEP are going to be using this SEP, and therefore will be subject to an SVI. So we have some examples here of folks who lose, including folks that lose either employer-sponsored coverage or people who are no longer eligible for Medicaid or CHIP or lose access to student health plans, but this is not an exhaustive list. We have a link here to a resource that Hallie developed and provides really, really good information and far more exhaustive of a list than what we have in this this slide. When people are eligible for an SEP due to a loss of coverage, they can pick a plan up to 60 days prior to the loss of coverage, and their coverage can start the first day of the month following the loss of prior coverage, or they can pick a plan up to 60 days after the loss of coverage, in which case their coverage starts the first day of the month following the plan selection. The other category of SEPs that now require SVI is SEPs related to permanent moves. In general, to qualify for an SEP related to a move, you must have had insurance for at least 1 day in the last 60 days. Moves from outside of the U.S. don't require that people had prior coverage. When people attest to being eligible for an SEP related to a move, they have 60 days from the date of the move to select a plan, and regular coverage effective days apply. It is important to note that people can qualify for more than one SEP, but the eligibility determination notice will select one SEP using some kind of logic that, quite frankly, we're not very familiar with. But as we understand it, it takes into account coverage effective dates. We don't believe that it takes into account whether or not SEPs will require an SVI. So we actually don't think that it will take that into account. So it may be that you qualify for more than one SEP. One of them does not require verification and the other does, but the one that your EDN is going to select for you might be the one that requires a verification. Okay. So I'm going to walk through the general process when a person selects a plan and has to complete an SVI. So let's say that the person first submits their application and that person attests to having an SEP and an SVI is generated. This person selects a plan, but the enrollment is pended while the SVI is resolved. The SVI clock starts ticking, giving this person 30 days to submit documents to resolve the SVI. Note here that we have 2 clocks ticking, right? One related to clearing the SVI, which is the 30 days, and another that's related to the SEP triggering event, which is usually 60 days from the date of the event. So there's kind of a lot happening already, and it's super important to be clear about deadlines. This person submits the documents right away, which is what we like to hear, and the marketplace reviews the documents. We understand that their goal is to review these documents very quickly. We don't know, how they'll be able to accomplish that. We've been hearing so far some good reports that it's happening pretty quickly. So let's have our fingers crossed and hope that that continues. If the SBI is resolved, terrific. The marketplace sends enrollment to the issuer and notifies the applicant that the SBI is resolved and the person pays their premium. If insufficient documentation is sent, the marketplace will request additional documents. If ultimately the marketplace can't verify eligibility for the SEP, the pended plan is canceled. Now we're going to walk through again, but only this time this person will not select a plan. So let's just see what's different about this process. So if the person submits an application and the person attests to having an SEP and an SBI is generated, all of that's the same. But this time no plan is selected. So therefore no SBI clock starts ticking. However, even though the SBI clock is not ticking, the person's SEP eligibility window clock is still ticking. So the person still needs to hurry. Let's say that this person submits the documents and the marketplace reviews the documents. If the SBI is resolved, again, terrific. But in this case, the marketplace notifies the applicant that the SBI has been cleared and also instructs the applicant to pick a plan. Then, let's say the consumer picks the plan, and then they would pay the premium to complete the enrollment. If insufficient documentation is sent, the marketplace will request additional documents. If ultimately the marketplace can't verify eligibility when the SEP window runs out, so here we're talking about the SEP window, usually 60 days after the triggering event, that person will lose the SEP eligibility if that window runs out and no plan's been selected and SBI hasn't been completed. So everyone who submits an application or changes an existing application gets an eligibility determination notice, which we refer to as an EDN. The EDN explains eligibility for coverage, financial assistance eligibility as well, if applicable, and also, if applicable, eligibility for a special enrollment period. If the person is subject to SBI, the EDN will indicate that. If the person needs to provide documentation to resolve another matter, like a data matching issue, the eligibility notice will also explain that. So imagine a consumer subject to both an SBI and a data matching issue. That would be a lot of information and could be a little bit confusing. So we're going to get back to that type of situation later in the presentation, but just wanted to pause for a second and just put that in your head, that there might be lots of people, or some people at least, that have an EDN that are trying to explain that both of these things are happening. So when a consumer has an SBI and also selects a plan that is pended, they will get a pended plan selection notice. And that notice will explain that the enrollment is pended until eligibility for the SEP is verified. And it instructs consumers to submit documents and lets them know which kinds of documents can be used to verify eligibility for that SEP. There's a whole new set of notices related to SBI. I'm going to go through them pretty quickly. Those who have an SBI and send in documentation, but it's not sufficient to resolve the SBI, will get an insufficient documentation notice that will say why the documentation is not enough and what can be sent to resolve the SBI. Some people will get additional time to submit documents if they are making an effort to provide requested documents but need more time. They will get a notice indicating additional time has been granted. People will get a notice warning them when they only have 20 days left in their 30-day SBI window. People will also get a reminder notice when they only have 20 days left in their 60-day SEP window. I'm going to pause for a second. when we think about these warning notices, both the reminder and the warning notice, 20 days left, or in your 30-day clock, and your 20 days left in your 60-day SEP window, I would imagine, but we don't know for sure. From what we know about how the processes go and how long it takes before the system can, when the system triggers notices to occur, I would assume that, and I'll be curious to hear from you all if this is true, I would assume that people may have turned in a document, let's say really fast, within that 10 days, and yet the marketplace might not be able to stop those other notices from occurring, which as a result will mean that consumers will be getting, likely, I'm not sure, will be getting these warning notices and reminder notices even though they have taken some kind of action. We've seen something similar to that in the data matching process world. So just something to note, that sometimes people get very concerned, might mean that you'll get more phone calls from people that are very concerned if they are getting notices even though they have sent in documentation. Okay. So SVI resolution notices will be sent to consumers when their SVI is verified. Note that this is different than what is happening under the verification process that was occurring prior to June 23rd. Prior to June 23rd, when consumers would be able, during this time, this is when the consumers have been able to enroll ahead of proving or providing verification of eligibility for an SEP. But when they did send in documentation about the SEP, they did not get confirmation that the SEP had been verified. So this is different than that. Now the person should ultimately get confirmation that the SEP or the SVI has been resolved. SVI expiration notices will be sent to those who did not successfully complete the SVI. If a person gets their notice during their 60-day SEP window, they can resubmit the application and start a new SVI window. But still, all of this has to happen within, before that SEP window closes. If the SEP 60-day window expires before a person selects a plan, the person will not receive a notice. We understand that in some circumstances, people may want to delay selecting a plan, but it is risky. Because if they miss their SEP window, they will have to wait until the next open enrollment period, or if they become eligible for a different SEP, I guess. And it's probably good to kind of discuss this with consumers whenever they're considering a delay in selecting a plan. There are some additional notices. Some people may go down the SVI path, and then the marketplace will detect that the person is already enrolled in a plan. When that happens, the pended plan is going to be canceled, and the consumer is going to be notified of this. Some consumers may have an SVI clock that runs out without submitting the required documents, but they also are eligible for an SEP that does not require documentation through SVI. Those folks will get a confirmation and enrollment notice. So this is a case where, remember how before I mentioned that people might be eligible for 2 SEPs and only one is going to be selected by the EDN process, and then people will be asked to provide documents if that SEP is subject to SVI, the verification process. It's a mouthful, sorry. If that's the case, and then they fail to get through the SVI process, the computer should be designed, it should be set up in a way that it will detect that the person's also eligible for another SEP, and then the person, if they have selected a plan, that plan will be confirmed, right? And they will move forward, that their enrollment will be sent to the issuer, and things will be fine in terms of being able to move forward. The consumer will be able to pay for their plan and move forward with coverage. So once an SVI is resolved, coverage will generally begin on the original coverage effective date, and consumers will pay first month's premium to effectuate enrollment. If an SBI is resolved after the original coverage effective date, coverage will begin retroactively. So insurer will be responsible for paying claims on covered services in that retroactive period, and we don't really know how that's going to work. We understand that there will be challenges in getting issuers to pay claims in other circumstances of retroactive coverage. So for example, in some cases where consumers got retroactive coverage due to an appeal, they later found it a little difficult to get issuers to pay for claims. So this will be something that we want to watch closely, and hopefully it'll be seamless, but we'd like to know if it's not, so please let us know. If an SBI is resolved more than 2 months from the original coverage effective date, the person can choose to have coverage begin 1 month later than the original effective date. Just in case folks are struggling with what this SBI acronym is that I'm using so often, SBI is when it's an SEP verification issue. That's what the letters stand for. And it's when there's an SEP that has occurred, and in this phase that we're currently in, the two that are already have already started include a permanent move and loss of coverage, SEPs. When a person has one of those SEPs and is trying to enroll in coverage with the SEP, they're now required to verify eligibility for that SEP. So the kind of short way of describing when that person has a requirement to verify an SEP is SBI, which is a big mouthful. So I just wanted to pause for a second and make sure that folks are that's clear, especially if you missed that one slide. Okay, so let's look at an example. Daniel, Marie, and Amina moved from Illinois to Ohio on May 13th. They are eligible for an SEP, but enrollment is pending until they prove eligibility for an SEP. They need to submit documents proving a move, which would have to prove both the old address and new address, right? 1 day of coverage in the last 60 days is also needed to be proved. They select a plan on May 21st, which starts their 30-day SBI clock. Got to get that verification in within 30 days. They send in documents on June 5th, and on June 12th, the SBI is resolved, and their coverage effective date is July 1. Next, we're going to look at Ricky, Ava, and they're told that they're going to lose Medicaid on May 31st. They're eligible for an SEP, but enrollment is pending until they prove eligibility of this SEP. So in other words, SBI, right? They need to submit documents proving coverage, end date, who will lose coverage, and the type of coverage they had. On May 23rd, they select a plan, and enrollment is pending until they resolve their SBI. Their coverage effective date is June 1st, because the loss of coverage effective dates allow people to start coverage sooner than the normal effective dates. So they receive a 20-day warning notice on June 1st. They send in documents to resolve the SBI on June 18th. On June 26th, the SBI is resolved and coverage begins for them on June 1st. Okay, so June 26th, they resolve the SBI. But their coverage begins on June 1st. This is an example of a family whose coverage begins prior to the resolution of their SBI. Okay. All right. So here is a list of documents that can be sent to prove that people have experienced a loss of coverage, okay? So in other words, these documents could be turned in to resolve that SVI, okay? I'm not going to read these documents to you, which I'm sure you're all very happy about right now, but we provide them here as a reference to you. There are lots of options, but note, when consumers don't already have one of these items, they may take some time to get from either the issuer or a former employer, Medicaid agency, or other entity. So working on this, like trying to gather these documents as soon as possible, it's going to be really important. Also note that some of these items, like a pay stub, might also serve a dual purpose and may be useful in resolving a data matching issue as well. We list documents that can be, here is actually the documents that we list for permanent move. And you know, we just want to remind you that proving eligibility for a permanent move can be a little bit more challenging because most people will have to prove that they moved, and they'll have to prove that they had insurance for at least one day in the last 60 days, of course, unless their move was from outside of the US. I've mostly focused on the phase 1 of the SVI implementation, but soon another phase will start in August, actually. It's very soon. People who attest to being eligible for another set of SEPs will begin to be required to complete SVI. In other words, another group of people are going to have to provide proof that they're eligible for an SEP before they can enroll in a plan. So this includes people eligible for an SEP due to marriage or adoption or placement in foster care or gaining a dependent through a court order, and for being determined ineligible for Medicaid and CHIP. Like before, we provide a list of documents that can be used to prove these life events as well. Like in the first phase, we think that people are going to need some help in figuring out what to send in and keeping track of the various deadlines. So just in case this was not difficult enough, we also want to cover a complex example. So SVI could be confusing without any other documentation requirements, but we know that that will not be the case for some consumers. Some consumers will have to send in documents to prove identity, others will have to send in documents to resolve a data matching issue related to either income or citizenship or immigration status, and some will get requests to submit all of the above. Yikes. So let's go through each of these categories just to review what they are and how they're different from one another and what the consequence is of not resolving them. So bear with me. This is a little bit of a review. A lot of you are very familiar with this, but just in case some of you aren't, we're just going to review it, okay? So identity needs to be proven for one person in a household so that the online system, the marketplace, in other words, healthcare.gov, right, can confirm that you are who you say you are. So the person applying is who the person applying says that that person is. And that you're not trying to impersonate someone else in order to gain access to the person's confidential information or to commit fraud by signing up for coverage under someone else's name. So it's not an eligibility factor, this identity proofing thing that's required, but those who don't complete this step can't apply online and will not be able to complete lots of tasks online, including selecting a plan or reporting changes, among other things. Most people never have to turn in documents to complete this step. Instead, there's an online test that's done that pulls information from people's credit history and then asks questions that only a person who is who he says he is would know the answers to. So for those who can't be verified in this way, many, which is a small group, okay, should be a small group. It might seem to you that you're getting a lot of people, but ultimately in the whole universe of people who apply for marketplace coverage, it is a small group. For those who can't be verified in this way, many will be asked to call Experian to try to resolve the matter over the phone, and if they can't resolve it over the phone, they'll be asked to provide documents to prove their identity. Other people are never asked to call Experian. They just jump to that next step of being asked to provide documents to prove their identity. In the meantime, people often call the marketplace to move forward with their application over the telephone, and that's fine, but I strongly urge people who've been asked to submit documents to prove this identity proofing piece to follow through with this request whenever possible, okay? It's far better for consumers to have full access to their online accounts. So this is not an eligibility factor like I mentioned before, but it is an important application process and a process that will sometimes result in consumers being asked to provide more documents, okay? Then we have data matching issues. The marketplace needs to verify certain factors like income and citizenship in order to prove a person is eligible. Many times, this is done through electronic interfaces with trusted data sources by comparing the information people input into the application to information that's in these trusted data files, okay? Oftentimes from government databases. When the information does not match up, it does not mean that the person is ineligible. It just means that, that more information will be needed to verify eligibility, and the person is asked to submit documents. The person is given either 90 or 95 days, depending on what kind of data matching issue has occurred, to send in documents, and can move forward with selecting a plan and enroll in a plan with subsidies if applicable, while the eligibility factor is verified. Failure to verify the eligibility factor results in loss of coverage or subsidies, or change in the amount of subsidies depending on the eligibility factor or factors that were not verified. So at the end of that 90 or 95 days, wasn't successful in terms of verifying it, that person might be completely shut out of coverage. A person might lose all subsidies or some subsidies depending on what's going on, okay? So then we have the SBI. If a person attests to being eligible for an SEP that requires verification, in other words, an SBI, they can move forward with selecting a plan, but that plan will be pended until the SBI is resolved. Ultimately, if the SBI is not resolved within the SBI window or within the SEP window, the person will be blocked from enrolling in coverage and using the SEP. So we have 3 separate reasons why documentation may be required. People are blocked in different ways for failure to ultimately providing the sufficient documentation, and people are treated differently during the window of time given to provide documents. It's a lot to keep track of, and it will understandably be confusing to some consumers. Indeed, we've already known that just having identity proofing and citizenship and immigration DMIs and being requested for documents for both of those things have already confused a lot of consumers in the past. And important to note that sometimes, to make it even a little bit more confusing, just in that one example that I used of an identity proofing and immigration or citizenship DMI, sometimes the same documents can be used to prove both of those things. And the good news is that CMS has said that when this kind of thing happens, in other words, when you have a request for documentation for something like an identity proofing, a request from documentation for something like a data matching issue, and a request of documentation for an SEP, to the extent one document is sent in can be used for more than one of those things, their goal is to use that document to clear more than one of, any of them that it could clear, okay? We think that's a fabulous goal. We hope that that's the way it's being implemented, and we also see that that could be a challenge, right, to implement something like that. So we're eager to hear from you all if that is indeed what you're experiencing, what you see. And we hope so. Now, I'm going to close, and I'm going to probably take a sip of water because that was a lot of talking, and I'm going to turn it back over to Hallie.
All right, bear with us. We have one more complex example that sort of puts everything that Shelby was talking about into kind of an example, since that's a lot of information. So we tried to play this out in an example. So let's look at Joe and Danielle. They are married and both enrolled in a plan through her employer. In May, Danielle quits her job, and her employer plan will end for her and Joe on May 31st. They're eligible for an SEP due to loss of coverage, and so they'll have 60 days before the loss or 60 days after the loss to pick a plan. So they complete an application on May 14th. In their eligibility determination notice, they are told that they're eligible for premium tax credits and an SEP to enroll in coverage. However, they also run into a few snags. They need to resolve an SVI, that SEP verification issue, by proving that they lost other coverage and are actually eligible for this SEP. And they also need to resolve a data matching issue and prove their income estimate for this year. Note that this DMI clock, the 90-day DMI clock, starts when they submit their application. Now, why do they have an income DMI? Since Danielle quit her job mid-year, the family expects that their income will be much lower this coming year than it was last year. This means that when the marketplace matches the family's projected income with data sources showing past income, the difference is great enough that a data matching issue is generated. Danielle and Joe will need to send in proof of why they projected their income will be only $24,000 this coming year, but the family can still enroll in coverage during this inconsistency period. They're going to have that 90 days to resolve the data matching issue. Now, why do they have an SEP verification issue? This is because the SEP for loss of coverage is subject to that pre-enrollment verification. So they need to verify that they actually lost or are losing coverage. Once they pick a plan, they'll have 30 days to submit documentation to resolve the SVI. Until then, their enrollment is going to be pended. So how do all of these various requests for documentation and different timelines work in practice? Let's say that Joe and Danielle pick a plan on May 16th, a couple of days later than they submitted their application. As Shelby mentioned, the SVI clock doesn't start until a person picks a plan. So when Joe and Danielle do pick their plan, they receive a pended plan selection notice that starts that 30-day clock to resolve that SVI. The notice also lets them know that their plan is pended, but once they resolve their SVI, their coverage effective date is going to be June 1st. So Joe and Danielle now need to resolve an SVI before their coverage can begin, and they must resolve a DMI by August to continue their coverage unaffected. So let's start with how they can resolve their SVI. Danielle sends in a few documents in early June. She sends in her letter of resignation with her last day of employment, and she also sends in a May pay stub showing employee contributions to an employer health plan. This resolves her SVI. But you may have noticed that this resolution occurred past the day when coverage was supposed to begin. So what happens? Coverage for both Joe and Danielle is effective retroactively back to June 1st. They're going to pay that June premium at that time, and that will effectuate their coverage. And as Shelby mentioned, if they used any services, any health services after that June 1st date, and they're covered services, the insurer must pay those claims, even though it's retroactive. So now let's look at the resolution for their DMI. Later in June, they submit several documents. They again submit Danielle's letter of resignation with her last day of employment, and they also turn in a few pay stubs showing Danielle's income from January through May. They also submit a pay stub with Joe's income, his most recent pay stub with his income from June. So you'll probably notice that Danielle's documents are essentially the same documents that she used to resolve her SVI. The marketplace may look at those documents submitted for one purpose to resolve another issue, but again, we're not really sure how consistently that will happen. And more importantly, to resolve an income DMI, it's a really good idea to include sort of a cover letter explaining how all the different income sources, all the different documents that you're submitting that are income sources combine to equal the projection the family made on the application. And so you'll have a cover letter, and then you'll also include those supporting documents that that get you to what your income projection was. So you'll have those all together, so it makes the DMI resolution hopefully easier. So now on July 27th, their DMI is resolved, and Joe and Danielle's coverage continues sort of undisturbed. If they don't resolve their DMI by the time that 90-day inconsistency period ends, then their subsidies will be automatically adjusted to be based on the income that the marketplace has in their sort of trusted data sources on their income. So with all of that, I'm sure you guys have lots of questions. Before that, there's just so much information here. So we have updated our special enrollment period reference chart, and that will have information on all of the different SEP triggering events, whether or not they have some sort of requirement of prior coverage, the timing of the SEP, the coverage effective dates, and then if there's plan selection limitations for that SEP for current enrollees. So that'll be a really good resource for you guys. We also have a bunch of links here that have sort of the rules and regulations that that you guys are welcome to go through that implemented all of these different rules. And then we have a couple healthcare.gov links that have the document list for how to prove a loss of coverage and how to prove a permanent move. And with that, we'll turn it over for questions.
All right. Thank you, Hallie. Could we just start with, could you clarify what does and does not apply to state-based exchanges?
Yeah, so there's a lot of flexibility with state-based exchanges. One thing to note is there's some state-based exchanges that use healthcare.gov, and they're going to have a lot less flexibility because they have to use what healthcare.gov has. So this is for marketplaces that have their own website and technology. So they are going to be able to have a longer open enrollment period. They do not have to implement this pre-enrollment verification for SEPs. And then for some of the other requirements, so for the plan selection limitations and the prior coverage requirement for marriage, there's the prior coverage requirement for marriage they do have to do, I believe. Yeah, so they do have to do that one. But for the plan selection limitations, there's some flexibility on timing. They have more ability on timing to get these in place, but we're not really sure entirely what that means. So that one's a little fuzzy. But the other ones, they do not have to do pre-enrollment verification. So that's really important.
Will healthcare.gov only show plans that the enrollee is eligible to switch to, or do assisters need to tell enrollees which plans are available to them?
That is a great question, and we have no idea.
We'll get back to you.
Yeah, we'll get back to you.
We'll find out. It'll be on our list, and we'll get back to you. It's a great question.
If consumers enroll in separate plans during an SEP, will the APTC and CSRs be balanced equally over the two plans?
Oh, this is, I think they can choose.
Can you repeat the question one more time just to make sure that I understand what you said first?
So if consumers enroll in separate plans during an SEP, will the APTC and CSRs be balanced equally over the two plans?
Well, no. Well, CSR will put aside and just say that there's no real balance in a CSR, you know, but on PTC, when you change a plan mid-year, one would hope that PTCs would be recalculated in a way to make sure that it takes into account kind of the PTC, but it's not quite that way. And we actually have a guest star in the room with us. Judy is gonna take this question.
Yeah. So on the CSRs, just think about it. There's really no allocation, right? Because you're eligible for a certain level of plan based on the the variation of the silver plan, and the household would be each eligible, so that would be applied to both of their plans. There is a rule. Well, I'm not going to get into that because that's a rule. If two separate tax households kind of combine, you end up in a different place. But let's leave that aside. On the allocation, I think it's really your choice. I think it's a choice of the consumer how to allocate. The household has a contribution, and how to allocate the premium credits across the different plans. That's my understanding. So you could just decide how to do it.
And I think the automatic is based on
Is
people
50-50. Yeah, automatically be 50-50, but you could choose a different allocation.
If the Medicaid or CHIP agency sends the client's file to the marketplace showing that they no longer qualify for Medicaid or CHIP, does that verify eligibility for an SEP?
Not that we know of yet. I think that there is an aspirational goal to have that kind of capability, but we should assume that it's not going to happen anytime soon.
Will warning notices be sent by mail as well?
It's another good question. I don't know. I mean, I'm assuming yes, but we should come back and confirm that, because when somebody chooses to get information through email, I'm not sure if this particular notice falls within the group that that would be emailed only, or if it falls into the group of ones that would be sent, automatically just mailed.
If documents are submitted on day 59, will it allow for a 30-day SVI window?
Yeah, I think it will. They need to pick that plan. That's sort of when you bump up against that. Yeah. So if they picked that plan on day 59, so they're within the SEP window and they picked that plan, they will have 30 days to submit documents to sort of clear the SVI issue, and then their plan would be effectuated on the original coverage effective date. Mm-hmm. So they picked it on the 59th day. Let's say it was loss of coverage. The plan would start the first day of the following month. Mm-hmm. But they would have 30 days to submit documents.
So if someone moves from one state to another state and they lose their employer-based coverage because of the move, they have an SVI to substantiate the SEP, but they are not currently employed, and therefore they have no income. And the state that they move to is a non-Medicaid expansion state. What if it takes longer to verify, longer than 60 days to verify the SEP window, and longer to find employment? Will they be able to use a new SEP once they find employment?
Sure. Yeah, so this is sort of tricky because remember the premium tax credits are calculated based on the annual income, an estimate of annual income. So this is obviously someone who is already employed for certain months, so they've kind of banked that income, and then they can, assume they're going to get a job and make an estimate. It's not like Medicaid where you actually are looking at someone's current income that month. So I think what I would do if I was an assister, I'd really help them, coach them through an income estimate based on what they've already made and what they expect to happen, and also tell them that they should come back if they actually end up with something else happening. So for example, if they can't get a job and it's going to make a big difference in their eligibility or their tax credits.
And then the last question that we'll have time for, where does a client submit the verification of SVI, or does the insurance carrier send it?
No, this is done through the marketplace. It is not done through the insurer. So your communication, if an insurer is asking you for that, they shouldn't be.
And we want to hear about it.
Yeah. So it should be, our understanding is that it's, if they have an online account, that's the easiest, and they kind of, much like with the data matching issue, there's sort of a button to upload documents for the SEP verification issue. You can also mail in copies of the documents, and they'll have the address and how to do that on that pended plan selection notice, and I believe they'll have it in the EDN too.
But just to clarify, we answered the question assuming that somebody has is enrolling in a marketplace plan. Somebody who's enrolling outside of the marketplace plan, then certainly the issuer might also be requesting that kind of documentation, and that's totally allowable.
All right, so thank you, Judy, Shelby, and Hallie. Just a couple of words in closing. As a reminder, we will be distributing the slide deck and a video recording of today's presentation via an email in the next week. And we will post everything to our Beyond the Basics website at healthreformbeyondthebasics.org. All of the materials from our Beyond the Basics project are posted to this site, including reference charts, guides, frequently asked questions, and key facts. Right now we don't have any webinars scheduled at this time, but we will update you all with a schedule for trainings for the upcoming open enrollment period in the next month or so. And you can also continue to check our upcoming webinars page on Beyond the Basics for information on upcoming events. If you have any questions or need assistance going forward, please email our Beyond the Basics contact email. It's beyondthebasics@cbpp.org. And with that, we'll bring today's webinar to a close. Thank you all for joining us today.